This is a presentation on hypertensive retinopathy as seen in patients with hypertension. So we'll talk about grades and clinical presentations. So the agenda of the talk would be defining hypertension, vascular changes as seen in hypertension as per the pathology and the vascular wall changes, grades of hypertensive retinopathy and corresponding symptoms and signs, and final tips and takeaways. So hypertension, as defined by the World Health Organization (WHO), is as any systolic blood pressure which is more than 140 millimeter of mercury and or मतलब इनमें से कोई भी एक चीज़ हो अगर, and diastolic blood pressure of more than 90 millimeter of mercury. So what are the changes seen in arteries in chronic hypertension? One should remember that hypertension primarily affects the arteries and capillaries. There is hardly any change seen in veins, although this can be secondary to interaction with the arteries which are undergoing some changes. So first thing is hypertrophy and hyperplasia. So the thickening of the arterial wall due to increased smooth muscle cell size and number, so that the arteries, they have a thicker and a rigid wall. Second is vascular remodeling. This is about the changes in the structure of the arterial wall leading to increased vascular resistance. Increased collagen deposition. This is also part of the remodeling of the vascular caliber and the wall thickness and stiffening of the arterial wall. The endothelial dysfunction, it's impaired endothelial dysfunction just leads to a reduced nitric oxide production and increased vascular tone, and also this can cause plaque formations and sedimentation of platelets. Arterial stiffness, because of this can in turn also cause increase in systolic blood pressure and cardiac workload. Atherosclerosis is accelerated, which is normally associated with aging, and this is accelerated and causes plaque formation and accumulation in the arterial wall. This can subsequently cause formation of platelet clots. So how do we grade this hypertensive retinopathy? We will see this with the help of a schematic diagram. So normally, as per the changes seen in the hypertensive retinopathy, there is some generalized narrowing of the arterioles, and this is because of the increased muscle tone. So this is grade 1, and where you can see and compare the vein and artery, and you would find the ratio between artery and vein is usually 2 to 3, which would change from this to a increasing ratio between the artery and vein. The sclerotic phase, which is marked by changes in the vascular wall, which would cause wall opacification, so that there is increased reflectance of the light from the vessel wall. There would be some changes seen in the crossing where the artery and vein are crossing, and there can be segmental narrowing and focal narrowing of the arteries. The exudative phase, which involves the incompetence of the endothelium, would result into hard exudates, cotton wool spots, which are basically infarcts, and flame-shaped hemorrhages and dot blot hemorrhages. The flame-shaped hemorrhages are more superficial on the retinal surface, and dot blot hemorrhages are more deep into the compact layer. Once you have continuous damage to the blood vessels because of hypertension, usually you start having choroidal involvement, which can result into SRF accumulation, that means exudative detachment, which can be inferior or at the macula, and it can also cause disc edema. So this is the grade 4 hypertensive retinopathy. So let us see with help of a clinical photograph how does these changes affect and are visible on the fundus. So hypertensive grade 1 retinopathy, and we will take this left hand side photograph as a template for normal, and we will be comparing the changes which occur in various grades. So the left side photograph is from a child which is about 15 years of age, so which would definitely represents a nearly normal fundus. So first thing is changes in the AV caliber, so that the arteries are less conspicuous and they are thinned out compared to the vein. And usually this is how we compare the AV changes, that the veins are thicker now and the arteries are narrower. And this ratio is known as AV ratio. Usually it is 2:3, and as the disease progresses, the arteries become narrower. The hypertensive retinopathy grade 2 is when you start having the vessel wall changes, and this causes some stiffness of the arteries. As a result, the crossings between the artery and vein, the vein which is thin walled and softer is pressed. And you also have increased reflectance of the arterial wall, which is seen as copper wiring, and progressively silver wiring when the blood vessels are so opaque that the blood column is not seen. Here we can see with that green arrow pointing out to the junction of the AV crossing, and we can see the artery is pinching the vein so that the vein is seen tapering where the AV crossing occurs. This is known as gun sign. Then you start having hypertensive retinopathy grade 3, where you start having the effects of the endothelial dysfunction and shutdown of the capillaries, which results into these kind of situation where you have soft exudates, hard exudates, superficial hemorrhages, and these are all basically because of the shutting down of the capillaries, causing ischemia and damage to the tissue. Soft exudates are actually infarcts, where you have hypoxia and the tissue undergoes a necrosis, ischemic necrosis, becomes opaque, and over a period of time it will regain its transparency, however the function is lost. These are the infarcts in the nerve fiber layer. Grade 4 hypertensive retinopathy is marked by addition of disc edema, and there may be exudation around the macula, and this is known as incomplete macular fan. As you can see here, the border of the disc is not well defined, and if you could have seen the disc in 3D, you would have seen that there was a protrusion of the disc into the vitreous cavity, and this is very subtle, so it is only seen when you have a good stereoptic view, and we can see the exudates in the macular area in the retina between the disc and the macula. So the takeaway message for this particular session would be that hypertensive retinopathy will have all these signs, and as they add up, you have a higher grade of hypertensive retinopathy. So you can have arterial attenuation, so that you have a narrowing of the arteries when compared to the vein caliber. Then you have the AV crossing signs when you have the arteries which are rigid and more stiff, so you have arteriovenous nipping, and then you have reflection of the light from the more opaque arterial wall, which is seen as silver wiring or copper wiring. Then you have the exudative phase where you have endothelial decompensation, and you have cotton wool spots, hemorrhages, and then added to that is presence of SRF and disc edema, which is grade 4. Thank you.